So I've been in the field now in prosthetics for about 32 years, and 26 of those were spent kind of in an outside patient care model where the prosthetic company is separate from the vascular surgeon or the people actually doing the surgeries. And I joined the Michigan Vascular about 6 years ago, and I immediately noticed the difference in the patient care model where the clinician or the prosthetist is actually part of the team. The vascular surgeon and the clinician work hand in hand to reach the greatest outcome possible. It really affects our patients from the very beginning. When I see the patient, or when the physician sees the patient and decides that there's an amputation that's necessary just because there isn't enough circulation to support the leg, they immediately call me in. So I'm meeting the patient preoperatively to answer any questions that they may have, to kind of help them through the process of realizing the fact that they're going to go through an amputation. So that education, that knowledge helps them smooth the process. Now, the surgeon and I also collaborate on the type of amputation that's going to be best for the patient. The longer residual limbs, the way they tie off the muscles with myodesis and myoplasty, all those things are going to help our patient get to a higher outcome. And that's one of the things I noticed immediately about this group as well, is that they were mostly concerned or only concerned with having their patients reach the highest outcome. How can we get these patients back into life, back to doing the things that they want, independent living, sports, golf, fishing, whatever it may be. How can we get them back to doing exactly what they were doing before? That is the only concern of these surgeons, and that's really amazing. So we see the patient preoperatively. We help them understand the process and how it's going to work. As soon as the surgery is done, I also go in and take care of all the post-operative care in the hospital. We fit the patients with shrinkers and rigid dressings, whatever it is that's going to help that patient get healed as quickly and as safely as possible. One thing that's unique is that when our patients leave the hospital and come back here to have their sutures removed or for that immediate post-operative care, I'm in the room with the physicians. So together the physicians are deciding from a medical perspective when that patient's limb is going to be healed, and from the prosthetic perspective we're deciding the type of components that can be used and when the quickest point that we can fit that patient is, but also safely. We find that our patients here get fit much sooner than an outside situation, because many times the surgeons would say, okay, it's time to go ahead and get your prosthesis, you're fully healed, and then the patient would have to seek out a prosthetist. They would have to go figure out which group accepts their insurance and which group is going to be able to provide them the best care, and then that prosthetist would then have to contact the doctor back to get a prescription and all the documentation. Here it flows effortlessly. One of the biggest hassles or difficulties for patients is also smoothing the insurance process, getting the proper documentation and the proper prescriptions and everything that the insurance asks for. Here, that happens at the time the surgeon says the patient is ready. All the documentation happens because I'm in the room. Anything that particular insurance requires, we make sure that that gets in the documentation for the surgeon, so there is no downtime. We find that we get the highest level components approved for our patients because of that collaboration between the prosthetist and the surgeon.